Good afternoon, Dr. Sosa. My name is Ryan Figueroa, and this is my Community Nutrition Intervention Program Proposal PowerPoint presentation. I want to start off by breaking down a quick outline of everything I'm going to be discussing during this presentation. This includes identifying my nutrition-related health topic, my target population, my behavioral theory used for my program, my intervention program itself, and lastly, my logic model and how it will foster change to address the nutrition related problem. All right, to start off, my nutrition related issue that I chose was obesity. I chose this topic mainly because I felt it's a very highly disease that is very prevalent in today's society, and it really is something that needs to be addressed, especially in our country today. So, kind of talking about some of the things that really stand out when it comes to obesity, I'm going to go over some facts and some statistical data that I found from some resources. So, when it comes to body mass index, typically obesity, you have to have a body mass index of greater than 30 based on height and weight. And within the US right now, there are about 41.9% is our average rate between the years of 2017 and 2020. And I can definitely say that number is increasing. And as far as health concerns, obesity does have the potential to cause type 2 diabetes, heart disease, cancer, and premature death if not treated. And there are some several factors also that are causes of obesity in individuals that sometimes out of control or sometimes it's within their control. And these include genetics, socioeconomic factors, medication or illness side effects, and poor dietary and exercise habits. And lastly, obesity does have an impact on your mental health negatively, and this could cause behavioral changes, food insecurity, and one behavioral health system I want to point out is depression, which there's a 55% percentage greater risk of developing depression for those who get obesity based on statistical data. All right, so based on that, the identified target population I decided to choose was the African American adult population. Um, this population, based on a lot of data and research online, really stood out as being really highly impacted, especially the older population, which is the ones I'm focusing on right now. This population, based on data found in the CDC, um, has a high prevalence of obesity rates currently, about 49.9% overall versus other population groups. And currently, about every 4 out of 5 African American women are obese currently and highly attributed to living a highly inactive lifestyle. And also, some of the factors that are leading African American adults, older adults, to they're causing to get high obesity rates include limited access to care based on where they're located currently, and also there are systemic and interpersonal racial disparities. Unfortunately, they're causing those limited access to care as well within certain areas of the United States, especially in the southern region, as you can see in the little diagram map that you see there. Kind of shows you some of those southern states that are really, you see the obesity rate is really high, and those are probably where you'll see more of the systemic interpersonal racial disparities, and also a lack of accessibility to health facilities. And some other determinants include are attributed to socioeconomic factors, again, related to lower income groups, educational levels, and structural racism. So again, these are some of the things that are really relevant within the African American population, within my target population, and they're really high determining factors or detriments they're attributing to African Americans getting obesity. All right, to continue from my last slide, I'm still on the topic of my target population. I want to go over some other factors that I found interesting. From a behavioral standpoint, some factors that obesity that contribute as well are some food insecurity issues, and currently food insecurity rates have averaged around 21.2% in 2019 for the African American community. And also, some factors that contribute to insecurity include just an increased cost of healthy foods, which obviously inflation in today's society has definitely impacted that, and also low income families and overspending on food, which you see 35% of overall income is being spent on food, and a lot of that is attributed to fast food and just not making good health decisions when it comes to choosing foods and limited access to care. And also socioeconomic conditions, unemployment, health insurance costs, and racial discrimination. So again, all that factors into the African American adults, just based on location. Again, those racial disparities, all those factor into causing obesity in this community. And lastly, 92% of African American state counties within the United States experience food disparities and have an increased rate of food insecurity. So again, these are all really important to factor in when it comes to my target population and why I chose them. All right, my health behavioral theory and strategies. So for my health behavior theory, I chose the social cognitive theory. This theory is an interpersonal theory that highlights how personal environmental characteristics impact behavior and describe how individuals obtain and maintain specific behaviors. Some of the advantages I really found interesting for this specific theory is that it also includes social influence, behavior modeling, and cultural relevance, which helps support development of community nutrition intervention program for obesity within the African American adult population. And also, um, some of the reasons why I decided to choose this theory within my program is that um, it will influence behavioral factors such as dietary habits and physical activity patterns by establishing positive role models who can promote healthy behavior to my target population through health fairs and social media event campaigns. So um, I decided to highlight. So for this specific health behavior theory, within my program, I will establish positive role models within my program to address these behavioral factors, and by doing so, it will help, and it also relates to this theory. And some of the behavioral factors include or such as cultural norms in education, and they will be targeted by my program by distributing health education materials via community engagement, events, and nutrition education workshops to help my target population access more affordable food options while promoting cultural relevance. So again, these are all things that tie into this health behavior theory, and these are some of the methods in which I plan to target some of these areas. All right, so now I'm talking about my intervention program itself. So my community health nutrition program. So I just want to start off talking about my program. So it's a 6-month physical and mental obesity prevention initiative program that I broke up into 3 phases. So you got your 3 phases, and they're like 2 months each phase, and they provide education on. And these phases will provide education on high risk factors related to obesity in African American adults and provide intervention strategies to achieve a healthier lifestyle. My program will also be focused on commonalities such as poor nutrition, physical inactivity, environmental factors, genetics, socioeconomic factors to decrease the likelihood of developing obesity while providing intervention strategies for my target population. Also, my program will also establish process objectives that will have, and these process objectives will be consisting of my support staff, which will be comprised of the following individuals to include community nutritionists, community nationally licensed dietitians, licensed clinical social workers, financial counselors to assist with also just the low income and accessibility of finding the right foods, and also who will instruct. And these individuals will help instruct information briefings, provide lectures and classes every week over the course of the 6 month program. And methods for gathering for data collection from my participants within for my target population participants within my program. This data collection will be conducted through surveys and individual nutrition risk assessments and body composition analysis data that I also will be collecting throughout my entire program itself. All right, I'm continuing to talk about my intervention program. So some of my learning objectives will be that at least 90% of all participants will be educated on effectively applying all prevention and intervention strategies against obesity, such as food labels, using food labels when shopping to identify healthier food options while still meeting their financial budget. Additionally, 90% of the African American adults will acknowledge their understanding of the common factors that they're taught associated with obesity and also demonstrate their understanding through feedback and application by developing their own individual healthy meal plans and recording their goals in a daily food diary. My participants will be provided nutritional educational classes to help support this objective and be given a pre and post test surveys to validate program success rates. So they'll be given surveys at the beginning of the program and also after they complete the program. My behavioral objectives will include at least 60 to 70% of participants will be writing their daily goals and individual positive outcomes through the aid of an electronic caloric intake meal tracker, workout diary application. So it will be a 2-in-1 application to track their progress related to their motivation and to establish healthier lifestyles. Lastly, 60 to 70% of my participants will list individual encouraging results and achievements through increasing their fruit and vegetable intake to 4 to 5 servings per day, plus performing moderate intensity exercise for 5 to 6 days per week, and attend motivational social support sessions at least once per week. My outcome objectives are 60 to 70% positive, 67% positive increase in dietary and physical activity habits and behavioral changes in socioeconomic health knowledge to combat and prevent obesity. Also, a 35% there will be a 35% decrease in obesity in my target population participant community and a 70% success rate of achieving obesity prevention program goals for all participants who complete the 6-month program. And this will be verified and confirmed through positive body composition analysis data, which we will conduct in laboratory blood work and physical mental wellness. All right, so talking about my logic model. So for this logic model, it will consist of the following phases: situation, inputs, activities, outputs, and outcomes. For my situation, so the situation currently that I have is, so we currently have my target population community, which is impacted by obesity. As of 2018, 4 out of 5 African American women reported the highest rate of obesity, and African Americans in general were 1.3 more likely to be obese than white Americans. My inputs consist of utilizing and investing my resources into a diverse staff to help educate, train, and support my participants within the program. And again, this staff will be consisted of community nutritionists, licensed dietitians, licensed clinical social workers, financial counselors, and peer support groups. My staff will assist in identifying clients with socioeconomic issues to refer potential participants to the program to receive the necessary resources they need, nutritional training support, and financial advice regarding shopping for healthy foods on budgets. All right, continuing on my logic model. So my activities will be focused on achieving our short, medium, and long-term outcomes. These will include community nutritionists teaching classes and providing interactive information forums to help participants become more knowledgeable while increasing their level of understanding of the causes, prevention, and intervention to combat obesity. Additional activities will include inviting guest speakers to my program and also have ambassadors to conduct seminars to serve as role models of exemplary healthy behavior. Also, we will host obesity social media campaigns and provide culturally relevant skill building workshops on properly accessing healthier foods or effective physical activity options. Lastly, we will include activities to help build community engagement by solidifying all the knowledge attained by all the participants throughout the, throughout the entirety of the program. This includes the participants developing their own personal intervention strategies as a result of completing the program and aligning their individual values while collaborating with local health clinics or community outreach centers, which will help integrate these changes within their community to encourage long-term sustainability. So this is encompassing everything that they've learned throughout the program and then demonstrating it by applying it within their community themselves, and that way they could help bring change within their local communities and foster change. Logic model continued again. So my short-term outcomes will include 90% of my clients or participants will understand how socioeconomic risk factors are associated with obesity and all the resources and interventions available for them in the program. 65% of clients will recognize the importance of implementing physical exercise 9 to 10 hours per week. My medium term outcomes are that 65% of participants have attended or will have attended modeling or role modeling learning seminars from my role models and ambassadors and participated within my social media campaigns and skill building workshops to help shape their obesity behavior contributing factors. My long-term outcomes are that 55% of my participants will achieve their health outcomes by sustained weight loss related to obesity, sustaining their physical activity and exercise habits built within the program, and advocating themselves for community changes and policy to support healthier lifestyles through community outreach for the African American community as a result. And lastly, I want to talk about fostering change. So with my community nutrition program proposal, I intend to make lasting, long-term sustainability for the African American community impacted by obesity. Based on my program goals, initiatives, and outcomes, I can successfully initiate effective interventions within my targeted population community to address a multifaceted nature of obesity challenges we encounter today. Lastly, my culturally relevant approaches and strategies will help create socio-cultural changes that align with my targeted population community needs moving into the future. Here are my references. Thank you for watching my community nutrition program presentation proposal. And if there are no questions, that is all for now. Thank you.